Hi students, welcome to sessions in oral pathology. I am Dr. Gopi Krishnan discussing oral pathology with you. Okay, so in the previous video, we have seen the classification of odontogenic cyst and tumors. Okay, so now let's take the most important cyst and discuss what questions they can ask you from this cyst. Okay, so Dentigerous cyst, I think it is very familiar to you. You may have seen it, you may have studied it a lot of times in your UG. Okay, but in the entrance point of view, what you have to learn from all these cysts, what questions they usually ask. Okay, so how to learn a cyst. What is the best way, or what is the easy method to learn and understand cyst? Okay, imagine you have two balloons. Okay, so I am taking two balloons. I have a red balloon here. Okay, I have a red balloon here, and I put this red balloon inside a green balloon. Okay, so I am putting this red balloon inside a green balloon. Okay, so I have two balloons here. I put this red balloon and I put that red balloon in the green balloon. Now I am going to blow air into this balloon. Okay, so I can fill this red balloon with air, okay, water, or I can put some substance in this, okay, whatever it is. So you know that the inner part, okay, that becomes the lumen. That becomes the lumen of the cyst. Okay, so that is the lumen where you have the content. Yeah, it may be a watery content, it may be a solid content, it may be air content. Okay, so whatever it is a lumen. Okay, and next comes that red balloon here. That red balloon that will act as the lining. Okay, lining. So that is a lining of the cyst where you can see the epithelial lining. So for a true cyst, you know that there is an epithelial lining, and this green part that will act as the capsule. Okay, capsule. So every cyst differs just in the lumen, lining, capsule. So how you have to learn is that what is present in the lumen. Is there any speciality for that content inside the lumen? And what about the lining? What is the speciality of the lining? How it is made? Okay, whether it is what stratified, whether it is 2 cell thick, whether it is 8 cell thick, is there any extra structure present in that lining? And what about the capsule? Okay, so every cyst differ in their lumen, lining, and capsule. Now let's take the dentigerous cyst. You know the dentigerous cyst. What is the specialty of dentigerous cyst? It's the most common developmental odontogenic cyst. Okay, so I always tell you the most common. If you see dentigerous cyst, what is the facts you should learn about dentigerous cyst is that it is the most common. It is the most common developmental. I am writing developmental odontogenic cyst. Why I am writing developmental odontogenic cyst? Because most common odontogenic cyst is radicular cyst. Okay, if they ask you which is the most common odontogenic cyst, this is always radicular. Radicular cyst is the most common odontogenic cyst, but it is formed due to inflammation. It is due to inflammation. Okay, but the developmental odontogenic cyst, that is your dentigerous cyst. Okay, most common developmental odontogenic cyst is your dentigerous cyst. So this is the fact about your dentigerous. So the other name is follicular cyst. You know why it is follicular cyst? The cyst arises inside the follicle. You know that when a tooth develops. Okay, when a tooth develops, so I have a tooth here. Okay, just imagine this is a tooth, and this tooth is covered or aligned before eruption. Before eruption, you know that your ameloblast, the last stage of the ameloblast. What is the last stage of ameloblast? That is reduced enamel epithelium, REE. Reduced enamel epithelium is the last stage of ameloblast, REE. So REE will cover the crown of the tooth. Okay, just like that. The REE is attached to the cemento-enamel junction and it will cover the crown of the tooth. Okay, so this REE will help. What is the duty of this REE? What is the help which is doing this REE is doing? Okay, you know that you can see a mother's love in REE. Actually, you know that ameloblast is a cell which make the enamel, right? So after the ameloblast secrete the enamel, after the enamel formation is complete, till eruption, till the tooth is erupted to the oral cavity, the ameloblast, the last stage is called reduced enamel epithelium. It will cover up the crown of the tooth and it will protect that crown. Okay, why it protect? If it is exposed to the connective tissue, what happens? There will be deposition of cementum, there will be deposition of hard substance on the crown. Okay, so to prevent that, the RE covers it. Now the problem is, in a normal tooth, the gap inside this RE, okay, gap between this REE and the crown is just 2 to 3 mm. Till 2 to 3 mm, it is okay. That is a normal. That is a normal follicle. Normal follicle. But sometimes some in some tooth the follicular space is little bit larger. You can see in the radiograph. So in certain tooth, if you take the tooth, okay, this is a tooth, and the follicular space it will become little more larger. For example, it may reach 3 to 4 mm. This much is okay. This is called the enlarged follicle. This is an enlarged follicle. Okay, but what happened is that if there is some kind of fluid accumulation within this reduced enamel epithelium and the crown, what happens, the space increases, that space increases. So this is a tooth here, and I have this cavity increasing here, and if it is more than 5 mm, we can say that now there is a cyst. Now this is a cyst. Okay, so REE, there is a fluid accumulation between reduced enamel epithelium and the tooth crown is forming a, now this is called a dentigerous cyst. Okay, so now you know what is the difference between the enlarged follicle and a dentigerous cyst. Okay, so this is how it is formed. Now, what are the other things they ask commonly? Which is the most common tooth? That which is the most common tooth or most common location where you can see dentigerous cyst is mainly your mandibular molars. Okay, your mandibular molars is the most frequently predominantly affected tooth with a dentigerous cyst. Okay, now other than that, the next comes your maxillary canines, then comes your maxillary molars. Okay, and then comes your mandibular premolars. So this is the order of occurrence. Okay, order of incidence, we say order of incidence. Okay, most commonly it comes in the mandibular molars, and then comes the canines, maxillary canines, then comes maxillary molars, then mandibular premolars. Okay, so this is how it occurs. So in one neat paper, there was a question that which among the following statement is true regarding dentigerous cyst. Okay, so which among the following is a statement? So they ask statement based question. It commonly comes in the mandibular molars. Yeah, that's a true statement. Okay, statement based question. Now there was one point. It come on a supernumerary teeth? Okay, can dentigerous cyst come on a supernumerary teeth? Can dentigerous come on a deciduous teeth? Okay, so can dentigerous cyst come in an odontome? Okay, can it happen? Yes, it can happen. So that's a true statement. Dentigerous cyst can come in any unerupted teeth. Unerupted teeth, it can come. Okay, it can come in a, dentigerous can come in an odontome. If there's an odontome is there and dentigerous can occur in that, dentigerous cyst can come in a supernumerary teeth also. Okay, if the person is having a supernumerary teeth, and that supernumerary teeth can, the REE of that supernumerary teeth can act as a what causative for the formation of dentigerous cyst. Okay, so these statements are true. There was a question in the previous, when you work out previous question papers, you can see this. And usually males are commonly affected than females. Okay, and it is very rare that dentigerous cyst comes in a deciduous teeth. It is very rare, but it is not a false statement. It can come, but it is very rare. Okay, so now what is next? How we should learn dentigerous cyst. So before that, I will show you the picture of a dentigerous cyst. See how that cystic capsule. See that cystic capsule. This is a cystic thing. Okay, and it is attached to the CJ. You can see the crown in this portion, the crown of the tooth. This is the root of the tooth, and you can see that that capsule is attached to that CEJ portion. Okay, so that is one thing. Now if you see the radiograph, I'll show you a radiograph. Can you see this radiograph? This is the radiograph of a dentigerous cyst. Okay, now in the radiograph, what you can see is that for a cyst, it is usually unicystic, means a single cystic. And for a cyst, the margins of this radiolucency, see this is a radiolucence. Okay, and the margins, can you see this? This is the outline of that cyst. Okay, that margins are very smooth, right? It is a unilocular radiolucency. So it is unilocular. Okay, this is unilocular radiolucent, I mean radiolucency, that is covering the crown of the tooth. Okay, attached to the CEJ, attached to CEJ, cemento enamel junction. So this is the peculiarity of the radiograph of dentigerous cyst. Okay, so there are three types of radiograph in dentigerous cyst. Okay, so if the crown is in the center. Okay, if this crown of the tooth is in the center of that radiolucency, we call it central variant. Okay, central variant. And if you see the radiolucency, it is towards one side of the tooth. Okay, that is towards one side of the tooth, then we call lateral variant. Okay, lateral variant. And if you see in this image, you can see that the radiolucency has occurred and it is little bit down than the CJ, and it is occupying little of the root also. Okay, some part of the root also is found in the radiolucent area. Okay, so that is called a circumferential variant. This variant is called a circumferential. Okay, circumferential variant. Okay, so there are three types, that is central, lateral, and circumferential. You can see the difference between all the three radiograph. This is the radiographic presentation of Dentigerous cyst. Okay, so we have learned the clinical part, we have done the radiological part. Now let's see the histology. Okay, so we are going to learn the histology of Dentigerous cyst. Okay, so histology of Dentigerous cyst is very simple. Now I told you we are going to learn in the form of lumen, lining, and capsule. Okay, so we have to see lumen. Okay, we have to see lining and the capsule. So this is how we are going to learn every cyst. We have a lumen. So you know that see this part is the lumen. Okay, this part is the lumen where you have this fluid component inside, and you can see this part. Okay, we have this epithelium here. Okay, can you see this epithelial lining? That is the lining part, and you can see this is the capsule. Okay, so from the histology you can see you have to identify lumen, lining, and capsule. Now when you get IBQs, image based questions, okay, the best way you can find out whether this epithelium is of any mucosa or a skin or a cyst. Okay, it is very easy. See, the lining doesn't have any retar ridges. Okay, for a cyst. Okay, for an oral mucosa, if you take an oral mucosa, you can see that the epithelium will have retar ridges like this. Right? You have epithelium and we have retar ridges. But for a cyst, there is no retar ridges. It will be a lining without a retar ridges. Okay, there is no extension to the connective tissue, no extension to the capsule. Okay, there is no retar ridges. So from the image itself, you can identify whether they are talking about a mucosa or a skin or a lining of a cyst. Okay, so what is the peculiarity of the lumen? Okay, first let's see what is the peculiarity of the lumen. What about the lumen of the Dentigerous cyst? What you get? Now, to identify what is the procedure we use to find in what is inside the lumen. Okay, so we have a cyst here. Okay, and there is a tooth which is associated with it. Okay, I have a cyst here. Now, how can you identify what is present in this? I will take a needle. I will take a syringe. I will put the syringe into this. Okay, I will put that syringe into this, and what will I do is that I aspirate some material. Okay, I will put the syringe in and I will take some material from the cyst. That is called aspiration. So we are using a fine needle for aspiration. That procedure is called FNAC, fine needle aspiration cytology. So we will take that fluid outside and we will see whether what is that content it is. Okay, what is the content in it? So what is the content when we put a needle into the Dentigerous cyst and aspirate? We get a particular type of fluid that is called straw colored fluid. We get a fluid is straw colored, yellowish in color. Okay, straw colored fluid, we will get it. So that is one indication that this is Dentigerous cyst. Now what I'm going to do, I took the fluid outside. Now I am going to assign or assess how much protein is there in that. Okay, so I'm going to do a protein assay. Okay, then I will do a protein assay. So I will take that fluid. I'm going to give for the protein assay. I'm going to check whether how much amount of soluble protein is there. Okay, soluble protein, how much amount of soluble protein is there? So I will get a value. If the value is more than 4.5 gram per 100 ml or per deciliter, the protein content, the soluble protein content in a Dentigerous cyst should be more than 4.5 gram per 100 ml. So these values are very important because they will give you clinical clue. A patient present with a swelling in the mandibular molar region, there is impacted 3.8 or 4.8. On fine needle aspiration, straw colored fluid was aspirated. Protein assay shows more than 4.5 grams. Okay, so diagnosis. So this is how every point is important for your diagnosis, right? Now I have done the protein assay. I got this for gram per deciliter, 4.5 gram per deciliter. Now there was a question in it: what is the fluid in a cyst? Is it a transudate or an exudate? Okay, so the color, the fluid inside the cyst is a transudate. Okay, so I will give you a homework that you should find the difference between transudate and exudate. In what conditions you get an exudate, what conditions you get a transudate. What is the difference between transudate and exudate? Okay, how much protein is there in transudate? How much protein is there in exudate? Okay, what's specific gravity difference between both? And this is an exercise you should learn. You should have a exercise that difference between transudate and an exudate. Anyway, we did the FNAC. Now what's next? We got the value. Now we are going to take the biopsy. Okay, we are going to take the biopsy. Either it can be taken by incisionally, or we can completely excise the cyst and give it. Okay, so the surgeon will completely excise the cyst and give it to us, and we will do the biopsy. And what we get is that we get a lining like this, right? We get the lining, we get the tissue like this. And where here you can see that the lining, see the lining is very thin. You know, it is reduced enamel epithelium. Actually, reduced enamel epithelium is just 2 to 3 cell layers. Okay, so in the lining, what you can see in the lining, you can just see a 2 to 3 cell thick. It is just 2 to 3 cell layers. Okay, you can see here only 2 to 1 or 2 cells thickness there. Okay, there's no retar ridges. Okay, no retar ridges, 2 to 3 cell thick. Okay, it's a flat cells you can see. So it is very simple. Now, one another thing you can see in the lining is that something extra you can see, and that extra is little dangerous also. Sometimes you can see mucus cells. Mucus cells can be seen. We say mucus metaplasia. Mucus metaplasia. What do you mean by that? In between these cells, somewhere, some places, you can see small mucus cells. Okay, the mucus is just like your salivary glands or something. Okay, just like the cells you see in the salivary glands, some cells will be mucus cells. That is called mucus metaplasia. Okay, so that is a that's a threat actually that we will come to. Okay, and in the capsule is nothing but it is just a connective tissue capsule. There is no significant finding in a capsule of a dentigerous cyst. Now, what happens is that you now you know that there is mucus metaplasia. Okay. Now, there is a problem with dentigerous cyst. Dentigerous cyst, if it is not treated, okay, dentigerous cyst. How you treat a dentigerous cyst? What is the treatment? You can either completely remove it. That is called enucleation. Enucleation is the complete removal of the dentigerous cyst is called enucleation. And if the cyst is very large, the cyst is very large, what the surgeon does is that you have seen kangaroos, right? Kangaroo has a pouch. Okay, kangaroo has a pouch bag where it stores his baby, right? So what we call these kangaroos are marsupials. Okay, marsupials. So we do a procedure called marsupialization. Okay, marsupialization means we will cut open the cyst. If the cyst is very large, just imagine the cyst is occupying all of the mandible. If I remove the whole cyst, the patient's whole mandible will be lost. Okay, so that is a very bad condition. Patient's vital structures will be lost. Patient will be in a bad state. So what I will do is that I will just open the bag, open the cyst. Okay, I will open the cyst so that the content will go out. I will remove all the contents. All the contents will be given out. So the pressure will reduce. So when the pressure will reduce, the cyst will collapse and it will give time to the bone to form. Okay, so bone to form, the cyst will now reduce in size. The 5 centimeter or 6 centimeter big cyst will come now to a 1 centimeter something. Then I will do the enucleation. Okay, so marsupialization is just cutting and opening, giving a pouch so that the content will come out. Okay, and then I will do the enucleation. So this is how the treatment of dentigerous cyst is done. What if I am not treating the dentigerous cyst? What is a complication? Okay, what is the complication? This is a question. Complication. This area is a very good question for your NEET examination. So what are the complications? If I am not treating the dentigerous cyst, it can give rise to an odontogenic tumor. It can give rise to a odontogenic tumor. Which odontogenic tumor arises from dentigerous cyst? Exactly your ameloblastoma. Okay, ameloblastoma. Your dentigerous cyst can give rise to odontogenic tumor, that is ameloblastoma. Sometimes this dentigerous cyst lining can give rise to a epithelial tumor, that is your squamous cell carcinoma. Okay, it can give rise to a squamous cell carcinoma. Okay, very very deadly. Now you know there were some at some points, at some places in that lining we had mucous metaplasia, right? So this mucous cells may give rise to a tumor which is glandular in origin. So that mucous metaplasia can give rise to a salivary gland tumor. So what is a salivary gland tumor which arises from the mucous cells? Mucoepidermoid carcinoma. Okay, mucoepidermoid carcinoma. See how dangerous a simple dentigerous cyst is. Okay, we may consider, oh, it's a dentigerous cyst, but see the lining has the potential, okay, malignant potential, okay, to form tumors. Okay, dentigerous cyst has a lining potential to form ameloblastoma. The epithelial tumor is squamous cell carcinoma. The salivary gland tumor is mucoepidermoid carcinoma. Correctly speaking, intraosseous mucoepidermoid carcinoma, because this is occurring not in the salivary gland, it's occurring in the jaw. So intraosseous mucoepidermoid carcinoma, that's the right term. Okay, intraosseous mucoepidermoid carcinoma is the right term for your what a salivary gland tumor arising from a dentigerous cyst. So this is about dentigerous cyst. So see the malignant potential, the cyst with the malignant potential is dentigerous cyst. Okay, recurrence is rare. Once you remove it, recurrence is rare. It won't recur. If you take the tooth out along with the cyst, it will not come again. That causative tooth is gone. Okay, so recurrence is rare. So this is about your dentigerous cyst. Now there's a term you can see in certain textbooks. Can you see can you see this picture? This picture will showing a swelling in the gingiva which is bluish in color. Okay, bluish in color. This is actually what happens is that when a dentigerous cyst, a tooth with a dentigerous cyst which erupts to the oral cavity, if it managed to erupt to the oral cavity, that cystic fluid or the cystic cavity is seen through the gingiva. So it is now not in the bone, it is now in the gingiva. Means it is in the soft tissue. It is now in the soft tissue. So that tissue, that cyst which is now in the soft tissue is called eruption hematoma. Eruption hematoma. So the soft tissue counterpart. So the word they use is that in the question paper, the word they use is that soft tissue counterpart of dentigerous cyst is your eruption hematoma. Okay, so this is now in the soft tissue, not in the bone. Okay, it has managed to erupt a little, and now it is in the bone. Now it will appear bluish purplish color because of the color of this blood vessels in the gingiva. Okay, so how to treat it? Just cut open it and facilitate that eruption. Okay, so that is it. Okay, this is about dentigerous cyst. Okay, I hope you understood dentigerous cyst, the clinical features, okay, the occurrence, the follicular spaces, radiographic features, okay, the histological features, and the FNAC, the lumen lining capsule. What is the specialty of lumen lining and capsule, and how you treat it, and what are the complications? I hope the dentigerous cyst is clear to you. See you in the next video with the next topic. Thank you.